Hi there, my name's Siobhan. I'm with the ambulance service. What was your name?
Christina.
Christina? Alright, I'm just going to take your pulse quickly, Christina.
Thanks.
What's happening to you today?
I'm not feeling that great. I've had a bit of pain, like around my stomach,
Okay.
for a couple of days, and then this morning it got really bad.
Okay. Alright. Have you felt anything else at all? Other than the pain in your abdomen, have you been sick at all?
Yeah, I've vomited a few times.
Alright, okay. I'll just give that one back to you. Have you ever felt this pain before?
Yeah, a couple of years ago, I had a problem. I think my GP called it biliary colic.
Okay, biliary colic. Okay, cool. And so it feels the same as it did that time, or is it worse or better?
It did. It's worse now.
Okay,
Yeah.
so
yesterday it did, but today it's really bad.
Alright, okay. Just going to conduct a vital sign survey, and it's found that the patient has a strong regular radial pulse with a pulse rate of around 100 beats per minute. Her rest rate is about 24 breaths per minute and it's unlaboured. BP is 110 on 70 with no postural changes. Temperature is 38 degrees Celsius with a tympanic measurement. SpO2 is 97%. Her BGL is 5 millimoles per litre and her ECG 4 leads showing sinus tachycardia and 12 leads showing no ischemic changes. So now, Christina, I'm just going to do a pain assessment on you, okay? So you said you've got this abdominal pain. Can you tell me how it started? Did it come on gradually or was it quite sudden?
Well, like last couple of days, like I said, I wasn't feeling it great, and then this morning I got up to go to the bathroom. It was really bad. I couldn't get back to sleep.
So it's sort of been the same or gradually increasing for 4 days and then quite severe this morning. Okay. Has anything made the pain better or worse over the past few days?
Not really, but I found that like if I eat anything, it kind of gets worse.
Okay, so eating made it worse. Is that still the case?
Well, I haven't really eaten anything just because I've been feeling really nauseous as well.
Understandable. Okay. Has lying down helped the pain at all or resting?
Not really.
Okay, no worries. And can you describe the pain for me?
So it's sort of like just like here, and then it goes up a bit to my shoulder as well.
Okay, so location-wise, it's just in here.
But that's like where the main pain is. Like,
Yeah.
my stomach hurts.
All over. Okay, and then up into your right shoulder, you said?
Yes.
Yeah. Okay. So how does the pain feel?
So it was really dull, but now it's really like it's really constant and really strong.
Okay, so
it's not really going away.
Okay, so before it was coming and going, and now it's there all the time. Okay. Christina, on a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, and 0 being no pain at all, how would you rate it out of 10?
Today I think it's probably about an 8.
An 8 out of 10? Okay. And in the past few days, has it been the 8 or?
No, probably like 3 or 4.
Okay, so it's definitely gotten a lot worse. Alright. And about what time was it that you noticed the pain started?
I think it would have been around 4 in the morning.
Okay, did it wake you from sleep or were you already up?
I don't know.
Okay,
Yeah.
not a
I
problem.
did notice it when I got up though.
You noticed it when you got up? Alright, okay. So other than this abdominal pain, you said you've been vomiting. You still feeling nauseous?
Well, yeah, I haven't eaten anything, so it's not really,
Okay. And I noticed that your skin is quite warm. Are you feeling feverish at all?
I'm a bit like,
Yeah, lightheaded or dizzy when you stand up?
Yeah.
Yeah?
I've just kind of been sitting down, lying down all day.
Okay. And when you vomited today, how many times do you reckon you vomited?
Probably about 3 or 4, but not much was coming up.
Okay. Have you noticed there's been any blood in your vomit?
No.
Okay. Christina, do you take any medications?
Yes, I take metformin and Panadol.
Okay. And have you taken any Panadol or pain relief today?
Yeah, when I couldn't get to sleep this morning, I took some, but I vomited pretty soon after.
Okay.
So, yeah.
Do you know what time this morning you took it?
It's probably about 6.
Okay, so it's about midday now, so you might be due for another dose of that. And just quickly, I've just got to ask this question. Are you currently sexually active, and is there any chance you could be pregnant?
No, I don't think so. I had a baby break up last year.
Okay.
Yeah.
Not a problem. So I know you said you previously had biliary colic. Is there any other medical history that you have?
Yeah, so I've got type 2 diabetes.
Yeah.
And like last time I saw my doctor, they said I had high cholesterol for some of my age.
Okay.
Yeah.
So no like high blood pressure, anything like that, problems like gastric problems, renal diseases,
Not
nothing?
that I know of.
No heart conditions?
No.
And you're not experiencing any chest pain at the moment?
No.
Okay, great. And Chris, I know you said that you haven't really felt like eating in the past few days. When was the last time that you were able to eat?
Last night.
Last night, okay. And have you been keeping up your fluids, been drinking lots of water?
Oh, I've been taking small sips.
Okay, great. So now I know you said that it wasn't anything specific that you noticed when the pain started a few days ago. Was there anything that you did during the day or at all that you think might have caused it?
The night before I went out, I went for dinner and then I went for drinks with my friends.
Okay.
So I got back pretty late. Yeah, and then when I woke up next morning, the pain started.
Okay. Did you have a pretty big night? Quite a few drinks? Yeah. Okay. No. Have you been to the toilet at all today, Chris?
Yeah.
When you passed urine when you went to the toilet today?
Yeah.
So when you're passing urine, did you notice any pain, any burning associated with that? No?
No.
And no like distinct smell or cloudiness to the urine? No? Wonderful. And when did you last open your bowels?
This morning.
This morning?
Alright.
And you didn't experience any diarrhea or constipation?
No.
No, and there was no blood in your stool?
I don't think so.
No, and no urgency to sort of get to the toilet? No, wonderful. So now I'm going to do an abdominal assessment on you, Chris. So I'm just going to get you to lie down and we'll do that. Alright, Christina, so we're just going to do an abdominal assessment on you. So what that's going to entail is just quickly I'm going to have a look at like, your hands, your arms, have a look at your face and your eyes and your mouth. Then I'm going to get you to pop your shirt off, lie down, and I'll just have a look, have a feel of your abdomen, see what's going on there. I also just use a stethoscope, have a little listen. Does that sound alright?
Yeah.
And you're comfortable with that?
Yeah, no
Wonderful.
worries.
Alrighty. So what I'm going to get you to do first is just let me have a little look at your hands. Alrighty, and then just fold them on over for me. That's it. Alrighty, look at your nails. So what I'm going to get you to do now is just pop your index fingers towards me like that and just hold them up. Make sure your nails are together. That's it, just looking for any clubbing. Alrighty, wonderful. Now what I'm going to get you to do, Christina, is just extend your hands out like this. Just flex your wrists like that and then close your eyes for me. Keep them flexed. Thanks. Alright, wonderful. You can relax your arms now. Just going to have a little look at your skin. And just up your arms there. On both sides. Alrighty, wonderful. And then just look at me. So just look at your face there. Beautiful. And then what I'm going to get you to do is just pull down your eyelid like that on that side. Keep your face up like that for me and look up. Wonderful. Alrighty, now Christina, I'm just going to get you to open your mouth for me. Beautiful. And now just poke your tongue out. Wonderful. And then just lift your tongue up. That's it. Thank you. Alrighty. So, I'm just going to have a little feel of your lymph nodes in your neck here. Sorry about how cold my hands are. Just checking for any inflammation there. Alrighty, wonderful. What I'm going to get you to do now is just to take your top off, if that's alright. I'm going to get you to lie down, put your head on the pillow here, and then I'll just do an abdominal assessment. Alright, so what I'm going to do now, Christina, is I'm going to get you to move your head towards the left hand side for me. So what we're going to do here is just assess JVP. And if required, can press down on the abdomen to just increase the jugular venous pressure. You can face your head towards the front again for me. Wonderful. Just quickly, I'm also going to assess your skin turgor, so hold that up. I'm just going to see whether you're dehydrated or not. Next, just assessing the abdomen for any scars, stomas, any pulsatile masses, any masses at all. No bruising, no obvious deformities. What I'm going to get you to do, Christina, is just pinpoint where the pain is for me. If you can just point to it. Just in there. So what I'm going to do first of all is just also take the bowel sounds to the right of the umbilicus for 2 minutes. Should be hearing bowel sounds every 10 to 15 seconds, but just assessing for 2 minutes to make sure there's no bowel obstruction. And then I'm going to also take just above the umbilicus to check 4 arterial brutes, which indicates your AAA. Next up, I'm going to palpate the abdomen. So what I'm going to do is to palpate all of the different quadrants. I'm going to start off away from this area here, just because that's the location of pain, and you just make sure you tell me if you're experiencing any pain at all. While I'm palpating, I'm just going to be watching Christina's face, just to see any signs of grimacing or any obvious pain showing on her face. Alright? So I'm just going to do this twice. So initially it's going to be quite light, and then the second time it's going to be a little bit firmer. Alright? A little bit of pain there, just in the centre, and then the pain's just here. And when I take my hand away,
Really bad.
it's worse when I take my hand away? Okay, so I'm just going to palpate for a second time. It's going to be a little bit deeper this time, alright? And then up here, once again that pain's worse.
Yeah.
Okay, when I take my hands, palpate the aorta on both sides, making sure that I've got pulse there. Make sure there's no pulsatile in either of the femoral arteries or in the aorta. Wonderful. And then what I'm going to do is going to palpate your kidneys. So that's just going to be just here. And then on the left hand side as well. Now I'm just checking for something called Murphy's sign. Alright, so what I'm going to do is deep breath out, and then when you breathe in again, I'm just going to be looking at your face, alright? So nice deep breath out. Alright. And breathe in for me. Alright, bit of a catch in the breath there, so we've got a positive Murphy's sign. Next up, Christina, I'm just going to check on the left hand side just to make sure, alright? So the same thing again, nice deep exhale, just pressing down there. And inhale again for me. Wonderful. So we've got no catch the breath there. And now what we're going to do is to percuss the abdomen. So I'm just going to be tapping on my fingers. Alright, so I'm just going to quickly go down the midline. Making sure it gets hollow down in the bladder. And then across the umbilicus. Wonderful. Alright, Christina, what I'm just going to get you to do really quickly is just sit up for me. I'm just going to have a little listen to your lungs, alright? And I'm also just going to check your back. Alright, Christina, so I'm just going to have a little listen to your lung sounds. It's going to also take your lung sounds, so I'm going to get you to take nice deep breaths for me, but don't try and hold your breath at all, okay? And I'm just going to use my open hand just like this to check your sacrum, just for any pitting edema. Just going to pop that one there, hold it for about 3 to 4 seconds. And then when I pull it away, making sure that there's no pitting edema there. Alright, Christina, so we've finished with the abdominal assessment now. So what I'm going to get you to do is to pop your shirt back on, and I've just got a couple more questions for you. Alright, Christina, just a couple more questions for you. Do any conditions such as diabetes, high blood pressure, high cholesterol, any kidney, liver, gastrointestinal diseases run in your family?
Yeah, so both my parents are type 2 diabetics as well.
Yeah.
They have high blood pressure, and then last year I think my dad had his gallbladder removed.
Okay.
And he's had kidney stones as well.
Okay. Alright. And in your daily life, would you say that you're generally pretty fit and healthy?
Yeah, so I don't eat that healthily, but I make up for it. So I do a lot of exercise, so I go to the gym a lot. And do lots of cardio. I used to be quite bigger last year, and I've been really working at it, and I've lost a lot of weight.
Okay. Would you say that you lost the weight quite quickly, or was it slow?
Yeah, definitely. It was fantastic. I was really happy. Yeah.
So it was quite quick?
Yeah.
Okay. Now you mentioned earlier that you'd been out partying on the weekend, just before these symptoms started. How often do you go out drinking?
Usually just once a week on the weekend.
Okay.
I used to drink a lot during the week, but I decided to be a bit healthier.
Okay. So you said you used to drink a lot. How was that every day?
Yeah, pretty much.
And how many drinks would you have every day on average?
Probably 3 to 5.
Okay.
Yeah.
You say you only go out once a week generally now. How many drinks would you have? in a night?
Like quite a few, you know, just because I'm going out once.
Yeah.
So probably like at least 10, probably more, like 15 maybe.
And Chris, do you currently or have you ever in the past used any recreational drugs?
No.
Are you a smoker?
No.
No. Wonderful. And what do you do for work, Chris?
So I work in an office. I'm
Okay.
I'm like an administration assistant, like secretary
Okay.
at the real estate firm up the road.
Oh, okay. So you generally sitting down in your office, or do you?
Yes, I sit at the front desk.
Okay. Yep. And do you enjoy your work?
Yeah, it's great. Yeah.
Oh, good. Do you feel stressed or anxious at work ever?
No, not anymore. I used to. When I was a bit bigger, it was really awkward.
Okay.
But yeah, I've got like my stress levels and my anxiety's gone down really well. Yeah.
And in sort of your home life, do you ever feel stressed or uneasy?
No, not really.
So you say you got a couple of friends at work. Are you quite social outside of work?
Yeah. So my mum just lives, like my mum and dad just live up the road, so I see them quite a lot, and then I've got lots of friends in the area, so we usually do stuff in the evenings.
Oh, great.
Yeah.
And you live alone in here? Yeah. So Christina, I'm just going to summarise what we found, and you let me know if there's anything you want to add, alright? So found that you've just had a 4-day history of generalised abdominal pain, and today, about 12 hours ago, onset of more severe abdominal pain, localised here in your right upper quadrant with some referred pain up into your right shoulder there. You've also, in the past 12 hours, had some nausea, vomiting, been feeling a bit feverish. Alrighty. We've also found that you are febrile at 38 degrees, haven't taken any paracetamol in the past. About 12 hours, 6 a.m. was your last dose. Yeah. Found that you're tachycardic at 100 but with a strong radial pulse. It's regular. And we've also found you're a bit tachypneic, so breathing a little bit fast, about 24 breaths per minute. All of these are quite indicative of you having an infection of some sort, and the location of your pain, and the fact you've got rebound tenderness, so pain when I take my hand away, indicates that you've potentially got cholecystitis, which is inflammation and infection of the gallbladder. So what I would like to do today is run you up to the hospital, and on the way we'll start off the treatment for you, alright? So what I'm going to do is give you an antiemetic, so that's an anti-nausea drug, just to stop you feeling so nauseous, hopefully stop that vomiting as well. I'm just going to pop a little line in your arm, just a little needle in your arm there. I'm going to give you some IV fluids, so kind of boost you up a little bit. I'm going to give you some more paracetamol, and also some pain relief if you'd like that. Okay. So when we get up to the hospital, I'll just let them know what's going on, let them know about your history over the past few days, and also just about a couple of the risk factors and red flags that have come up. They're probably going to give you some antibiotics, probably going to do another assessment on you, might do an ultrasound, and then you might have to have a surgery just because it is potentially your gallbladder. Alright, how does that sound?
Yeah, that'd be great.
Okay.